I'm going to give just a very brief overview of the state of the field, current understanding of ventricular unloading. This is all about unloading, and in about 2018 we offered up this, this definition of unloading, which was defined as the reduction of total mechanical power expenditure of the ventricle, which correlates with reductions in myocardial oxygen consumption and hemodynamic forces that lead to ventricular remodeling. So that's a little bit abstract, so to make it a little bit more concrete, we can see this on these pressure volume loops. If we start from the baseline, you see on the left side, if we unload the ventricle with a device like the Impella, you see that the loops shift leftwards, and it reduces the total work, the end diastolic pressure, and also what we refer to as the pressure volume area, which is the index of myocardial oxygen consumption. And you can see on the right side, we have the relationship between pressure volume area and myocardial oxygen consumption, starting from the dot towards the right upper part of the curve. When with the unloading, we see that the myocardial oxygen consumption is shifted downwards and leftwards. So we have a marked reduction in myocardial oxygen consumption that is due to this unloading. However, it's not only about that, because in the setting of cardiogenic shock, for example, patients are being treated with inotropes and pressors. Once you unload the heart and take over for the work of the heart, you have the possibility to withdraw inotropic and pressor support. And when you can withdraw those types of medications, it results in a decrease in heart rate, less inotropic stimulation, while at the same time you're maintaining cardiac output, blood pressure, and a lower normal wedge pressure. And these all have the effect of potentially further reducing the pressure volume area and the myocardial oxygen consumption. So there are primary and secondary benefits to the myocardium in terms of oxygen consumption of using an unloading strategy, not only in cardiogenic shock, but other areas as well. And I've just touched on very high level, looking really just at myocardial oxygen consumption. But as we know from this review article that we did several years ago with Dr. Kloner, that there are many aspects of the physiology of the myocardium that are impacted beneficially by myocardial unloading. And we're going to hear a lot more today about many of these aspects and new things that are going on in this field. Over the past 6 years since ACURE has started, there have been a lot of milestones that have been reached that really have brought unloading to the forefront. We've had the seminal pivotal, the pilot study of the door to unload. We've had, we now have the Protect Kidney study that is ongoing. We've seen now another form of unloading that's been introduced with the concept of precardia, which is unloading the kidney that we're going to be hearing about. We have the IMPACT study, which is surgical use of unloading in the context of surgeries. We also have many examples now of Impella being used as an enabler for other high-risk procedures, such as bridging heart failures through non-cardiac surgeries, and other cardiac procedures like high-risk MitraClip and TAVR procedures. Many new initiatives are being launched this year, not the least of which is looking at the impact of unloading on microvascular obstruction. So the field of unloading is really exploding, and I think the most exciting thing is that we're seeing this really impact on clinical care. Now also, there has been, I think it's very pertinent to note that over the past few years, there's a lot of extremely valuable basic science that is really starting to intercalate into the field of unloading. And in 2019, the Nobel Prize was awarded to Greg Ceniza at Johns Hopkins for the discovery of HIF-1. And you could see here on the right side that from Dr. Kapoor's lab, they've seen in the effects of unloading. You see in this box the effect of unloading prior to revascularization, the significant reduction in myocardial infarct size, and in fact, he has implicated the HIF-1 alpha pathway in this mechanism. So we're touching on an important, very fundamental aspects of unloading and how it's impacting on our understanding of this protective effects in the context of cardiovascular diseases. And this past year, Artem Pataputian got the Nobel Prize from Scripps Research Institute, got the Nobel Prize for the discovery of piezo-1. And piezo-1 is a protein that's a channel on the membrane that responds to force. And you can see here that when force is applied, it changes the entry of calcium into the cell, and that obviously has a huge impact on myocardial contractility and all the things that we're talking about. So there's probably logical to assume that there's a link between unloading and these very, very fundamental processes that are now a lot more being understood